Welcome, everyone. Thank you so much for joining us this evening or this afternoon, depending on what time zone you are in. I am excited to continue the conversation about the relationship between sugar and oral health. So I absolutely love this title called Kiss It, because I think it's important that when we are talking to our patients, we need to be sure that we are keeping it scientific yet simple. My name is Dr. Joy Voigt Holmes, and I will be presenting to you today. So before we get started, do know that all listeners should apply their own professional judgment and experience with respect to all of the information provided. I do want to thank HaltDent for their continued support of me and for their support of tonight's educational program. Just a little bit about me. I am a dental hygienist. I received my initial training at Howard University School of Dentistry. The following year, I received a Bachelor of Science in Dental Hygiene from the University of Maryland, Baltimore School of Dentistry, and then 2 advanced degrees, my master's and doctorate from Nova Southeastern University. I currently own my own company, Dr. Joy RDH, and I am co-founder of Gel Ed, which is a company where we pride ourselves on bridging the gap between education and the educator. I am currently on the editorial review board of Inside Dental Hygiene and the clinical advisory board for VTAL. And most recently, I'm serving as a member for the Maryland State Board of Dental Examiners, along with the Commission on Dental Competency Exams. So some of the key points that we are going to be discussing this evening or this afternoon, once again, we're going to be talking about the nutritional aspects of periodontal and caries disease that are associated with sugar consumption. We're going to talk about the classification of sugars in various dietary sources. And then last, we're going to discuss some of the protective strategies that should be considered for patients with an unbalanced diet. So nutrition, what does it mean? I know that we hear a lot about nutrition, not just with our CE courses, but in the media, TV, social media, on the internet. But what does nutrition really mean? So nutrition, believe it or not, is a reasonably new science that is interpreted as the process by which living things obtain nutrients, assimilate them and use them for energy, growth, development, and maintenance. And this process involves biochemical and physiological reactions in the human body to include ingestion, digestion, absorption, transportation, and finally the excretion of waste. Nutrients, on the other hand, are those biochemical substances that are supplied by the food, which are needed for the growth and repair, while diet is referred to as the quantity and the quality of food and beverages consumed by individuals on a daily basis. So without us even knowing, there are these processes that are constantly occurring within our bodies. Diet, oral health, and nutrition are interrelated. We can't get away from it. And as this relationship continues to be highlighted, dental professionals need to be knowledgeable about the significance of their role in educating their patients about this association. There are several major organizations that support the dental professionals' role in this education process. You have the Academy of Nutrition and Dietetics and the National Academy of Medicine, which is formerly known as the Institutes of Medicine. They both support education and training health professionals to integrate oral health with nutrition and diet. And then you have the World Health Organization. And so they highlight the importance of oral health professionals promoting oral health and emphasizing the consideration of diet and nutrition to help prevent oral diseases. And of course, we have the ADA and the ADHA. So the ADA encourages dentists to routinely counsel their patients about oral health benefits of maintaining a well-balanced diet and limiting the number of between meal snacks. Both organizations do support professionals staying abreast of the latest science-based nutrition recommendations and nutrition-related screening, counseling, and referral techniques. And that can be really, really difficult, especially in the age of social media. There is a lot of misinformation floating out there. And so, it's not that we're not busy enough with treating our patients and then taking care of ourselves, sometimes it can be really, really overwhelming determining what is the information that we should be sharing with our patients and what is actually real. So, it's really important to take courses like mine and other courses to make sure that we're staying up to date with what we need to. Excuse me about that. So let's talk about the oral microbe. Okay, so recent attention has been given to the influence of diet on the oral microbe. And the oral microbe is actually heavily influenced by the diet. Our oral microbe really is the communal relationship of healthy and pathogenic microorganisms that coexist in a synergistic relationship in our mouths. This oral microbe is the second largest microbial community in the human body. The largest is the human gut. So the microbial inhabitants of the oral cavity, they can attach themselves to both hard and soft structures. So at any given time, you have over 1,000 different bacterial species with around 20 billion residents that exist at any one time. Together, they form what we call biofilms, and they can differ in composition based on the specific surface that they're on, where they are located in the oral cavity, the person's health status, and then environmental conditions, such as carbohydrate intake and the gingival trabecular flow. So a neutral pH helps to maintain that microbial balance in the oral cavity. Anytime we have a diet consisting of excessive amounts of carbohydrates, sugar, acid, or low fiber intake, it will initiate a significant pH shift. And it causes an oral imbalance where you have these pathogenic microbes like Streptococcus mutans to thrive. Certain bacteria will certainly flourish in an acidic environment. We have some studies that show that diets that are high in fat are associated with high levels of P. gingivalis in the oral cavity. And we know that that can be associated with various periodontal diseases. So what we ultimately want to achieve is a well-balanced diet that consists of foods that have antioxidants that are both alkalizing and anti-inflammatory in nature to help us maintain a neutral pH in the mouth and overall a balanced oral microbe. And that can be really, really hard. The Western diet is just not oral health friendly, not all of the time. There is a lot of research that has occurred in the past and that is continually ongoing about the relationship of diet or sugar specifically and dental diseases. This particular article entitled Integrated Hypothesis of Dental Caries and Periodontal Diseases, that was written in 2020, and this is in the Journal of Oral Microbiology. This article was a review, and again, it talked about the relationship of sugar to perio and caries disease. This review addressed a lot of existing information in the literature, and it had some interesting points. And in fact, I used this article to highlight some very important points that I will be addressing over the next few slides. So in summary, the authors concluded that the ecological hypothesis is based on the dynamic stability stage of the oral microbiota. And don't worry, I'm going to explain what all of that is. And so basically they say that it's these intrinsic and bacterial resilience factors that help to maintain this ecological dynamic stability, which is typically compatible with clinical health. They state that the loss of these resilient factors and the prolonged changes in our mouths may shift the ecological balance of the microbial environment in our mouth, and it may shift it in either an acetogenic direction or alkalinogenic direction. In order to maintain and restore this dynamic stability in our mouth, it is necessary to control the drivers of disease, such as the salivary flow and the influx of bacterial nutrients into the oral cavity. Excessive intake of fermentable carbs may contribute to inflammation in periodontal tissues, resulting from hyperglycemia. It goes on to state that an integrated hypothesis emphasizes that both dental caries and periodontal diseases originate in the dynamic stability stage, and they emerge in response to nutritional imbalances in the microbiota. Last, periodontal diseases may belong to the sugar-driven inflammatory diseases that are similar to diabetes, obesity, and cardiovascular diseases. I find most often when we talk about periodontal diseases, we're more focused on bacteria and we haven't considered enough of diet. So, what is the ecological hypothesis? So, according to the ecological hypothesis, there are changes in the environment that can predispose a site to disease because of modifications in the composition of the resident microflora. So, specifically, it's referring to the metabolic activity of the resident microbiota. This activity will cause a regime shift, if you will, due to the changes in the local nutritional and immunological environments. And so, believe it or not, this holds true for most biological ecosystems. You heard me refer to the dynamic stability stage. What does that mean? So, I'm going to read it off the slide. It's an equilibrium where teeth, gingiva, and oral mucosal surfaces remain clinically sound in spite of the presence of dental plaque. So it really refers to symbiosis. So, the symbiosis is a status provided by dynamic stability. So this is a natural phenomenon that is occurring in our mouths at all times, 24 hours a day, 7 days a week. So those 20 million microbes residing in the oral cavity are either being fed or they're being starved. And this happens actually on any tooth or any surface. This results in constant fluctuations of pH in your dental biofilm, okay? So typically at this stage, this dynamic stability stage, the pH will typically fluctuate anywhere from between 5.5 to 7. In a healthy individual, these shifts in pH are usually balanced over time, and they typically will not result in any rise of clinical disease based on their salivary function and the clearance mechanisms in their gingival crevicular fluid. These compensatory activities, so if you've heard me speak before, what I like to say is that your mouth is in a constant state of demineralization and remineralization. In a healthy individual, this balance is maintained. There's typically no disease that can occur from this. The dynamic stability stage is compatible with clinical health, again. And so, again, you have that microbial community that is stable and it is balanced because it is able to control those disturbances by external factors. So anytime that there's a disturbance, eventually you're going to see some sign of disease. What I thought was interesting is in the article, they stated theoretically, there's no such condition as pristine dental health. So this is something that we often talk about in perio. And the reason why they say that is because as metabolic microbial processes occur incessantly in dental plaque, subclinical signs of dental diseases cannot be prevented. However, their clinical manifestations can be controlled. So I thought that that was really, really interesting. So how are we able to balance the disturbances by these external factors? We do this by resilience. So resilience in any ecosystem, or in this case, in our mouths, help us to resist those disturbances that will disrupt this equilibrium. The most important aspect of resilience is the ability to reorganize and renew after a disturbance. So just imagine you were standing in front of me and I walk past you and I knock you down and you have the ability to get back up. As long as I'm knocking you down and you're getting back up, you still are able to recover. Anytime there is a loss of resilience, that can destabilize any previously stable community and turn them into new stability domains, or as I mentioned earlier, you get this regime shift. And so in cases of oral disease, you're actually going from a more symbiotic relationship to one where you have those pathogenic microbes actually dominating. We have both intrinsic resilience factors and bacterial metabolic resilience factors. So our intrinsic resilient factors actually are our saliva, our gingival crevicular fluid, and our desquamated epithelium. And then, of course, with our bacterial resilience, we have our bidirectional pH metabolic regulation and our autotomic metabolic repression. So our bacteria, the bacteria in our mouths, it actually depends on a nutrient-rich saliva for survival. anytime we have an overcompensation or consumption of carbohydrates from our diet, this can lead to an excess of acid byproduct. And so that's when we get that rapid reduction of pH in the mouth to less than 5.5. Okay. We know that this acidic environment can temporarily impact the mineral balance on the tooth. So our saliva is really important because it has the ability to wash out those carbohydrates, those acids in our diet, and it can neutralize the environmental pH. It has a bicarbonate system in it, where it has the calcium and phosphate. And so all of that together helps to neutralize the environment. And similar, what we see in gingivitis is that flow of that gingival pervicular fluid. It has a washing and a pH neutralizing function in the gingival crevice. So these are very, very important. It is really important that we focus on the maintenance of the resilience of the oral microbiome rather than its restoration. And why do I say that? Science has determined that it can be really, really hard, okay, to restore resilience factors unless we are controlling other things such as sugar consumption. And we know, as I will later talk about, sugar is in almost everything we eat. It is in almost everything we eat. So we need to be mindful of that. So something that most people can relate to when I talk about the breakdown of resilience, I always say it's much easier to gain weight and harder to lose weight. So as it pertains to resilience, once again, it is relatively easy to break down the resilience in the oral cavity, but it is difficult to restore it. Why? Because the mouth has several surfaces that contain bacteria that shed into the saliva everywhere. So you have bacteria on your teeth, your tongue, your oral mucosal surfaces, and the pockets. And although it exists everywhere, everything is connected and it's in one place. So in order to restore resilience, you will rely on restoring the balance of the microbiota in the mouth everywhere. And sometimes that's not easy to do. In order to be successful in restoring the resilience of microbial communities on teeth, it may be necessary to restore that functional balance in the entire mouth. What science tells us is that there's not enough evidence to show us that this goal is easy to achieve. And in order to do this, you must take a more holistic approach to the process, and you have to consider other risk factors and other extrinsic factors. What happens when we introduce environmental pressures? We get a breakdown in that resilience. So, this is a little picture here. I didn't think it had sound, so my apology. I thought it was just more of a gift. But this is like a tsunami or a hurricane. And imagine what's happening to the area when this hits, okay? Everything just shifts around, okay? So we are getting this shift when our resilience breaks down. What happens with this shift? We're either going to be, once again, in a more acidic or more alkaline environment, okay? And pathogens that are responsible for caries and periodontal disease can thrive under either condition. So just to give you an example, we talk about this regime shift or this pH shift. You have, again, certain bacteria that survived in an acid stage, as I have listed here. And then you also have bacteria that can survive in the alkaline stage. So it is always best that we do what we can to make sure that our oral microbiome is not too acidic or too alkalinic, if that makes sense. This pH shift that is occurring in our body is something that we like to refer to as selection pressure. So this is the extent to which organisms possessing a particular characteristic are either eliminated or favored by the environmental demand. So in the oral cavity, selection pressure controls whether your biofilm is going to be normal or whether it is malfunctioning. So when we talk about sugar, there are two main diseases that we really need to focus on. The first is caries disease. As Dr. Kim Pucha says, dental caries is the disease that causes cavities, and it is the number one disease of mankind. And I want you to think about that because as dental professionals, we know how easily preventable this disease can be, or is it? But it's definitely controllable. We know that caries disease can impact every country and every demographic in every country. It can be complex to diagnose. It can be complex to treat. And sometimes getting to the root cause of caries disease can be challenging because it's multifactorial. As I will state later, there's no one single parameter that is responsible for caries disease. Our rates continue to grow despite all of the technological advancements and the products that we use and the science and the studies of microbiology. Caries rates continue to grow and the oral health burden remains unchanged. But why is that? Why are we still suffering? And I really take it back to diet. We know that cavities are caused by a disease known as dental caries, which is an imbalance of the biofilm. And I think people are just too focused on, well, if I don't eat sugar, I won't get caries. But we really need to start paying more attention to that biofilm. So this imbalance in the biofilm with respect to dental caries is not cured by simply filling the cavity, okay? We can treat it and we can control it if we have a solid understanding of what is going on. So as a quick review, what is biofilm? It is a complex communal three-dimensional arrangement of bacteria, okay? Why is it such a big deal? Why is so much attention paid to biofilm? Well, we pay a lot of attention to it because we're finding out that, it continues to be really, really complex. A lot of what we understood about biofilm 10 years ago has just been disproven about some of the current research. What do we know about biofilm? So if you take a look at the pictures here, you will see that these biofilms have a very unique architectural structure. Biofilms are not uniformly distributed. Okay, the bacteria is not uniformly distributed throughout the biofilm. So instead, they present as aggregates of microcolonies that vary in shape and sizes. So the goal for a lot of our patients, why do we stress brushing as often as we do? And why do we stress interdental care as often as we do? And why do we stress the importance of returning in 2, 3, or 4 months to some of our patients? It's because we want to get a hold of those bacteria before they become these biofilms, these colonies, which can be really, really hard to disrupt. You will note that within these colonies, you see these different channels, and this allows for the circulation of nutrients and byproducts. So this provides a system to eliminate the waste, all righty? Our bacteria, the biofilm in itself, they're very, very sophisticated, and believe it or not, they do communicate with one another by a process called quorum sensing. And this enables the bacteria to monitor each other's presence and to modulate their gene expression in response to the number of bacteria in a given biofilm. So this essentially can coordinate disease progression. So it's almost like, they're just different gangs established. You have the same gangs and they're spread out everywhere. And I guess if numbers get low in one spot through quorum sensing, they can say, hey, we need a little bit more help over here. And sometimes you will see that a part of the biofilm will break off and reestablish itself someplace else. When we talk about the human tooth, and it's important that we talk about this in relationship to the sugar to have a solid understanding of what's going on. We know that the human tooth is made up of enamel, dentin, and pulp. This human tooth, both enamel and dentin, they are comprised of an inorganic material called hydroxyapatite, okay? And so the tooth surface typically has a negative net charge, but so does the bacteria. So initially you have a repulsion, but when plaque biofilm is introduced, this defense mechanism is broken down. And this plaque biofilm grows when starches and sugars are introduced into the oral cavity through the human diet. So this is really, really important to note, especially when we're talking about sugars. There are a number of host factors that we need to consider in terms of how caries and periodontal diseases are derived. Again, there's no one single parameter that is responsible for the development of caries disease or periodontal diseases. You have to consider a lot of host factors like the tooth surface, food selection and dietary patterns, oral hygiene habits, genetics, time and frequency. We know that certain races, ethnic groups, or ages are more prone to these diseases. And we also need to consider the socioeconomic status of people. When we start to talk about periodontal disease again, it is plaque biofilm, there's that plaque biofilm again that causes a host response resulting in gingivitis. It's important to note that the bacteria themselves are not directly responsible for periodontal disease or diseases. It is the host factors that contribute to the disease initiation and progression. So in this article, it talks about fermentable carbohydrates that may be the forgotten cause of periodontal diseases. It is well known that hyperglycemia and diabetes can cause inflammatory damage to human tissues, in particular the capillary endothelial cells. The reason why these endothelial cells are vulnerable to hyperglycemia is because they are defective in transporting glucose over the cell membrane. And so we know that this leads to toxic concentrations of glucose inside the cell. So this condition usually invokes a series of host intracellular metabolic events. And so there's increased susceptibility to oxidative stress. And then you get the production of AGE. And these are precursors, all of which can lead to inflammation and microvascular pathology. So this is similar. These are similar host metabolic pathways that have been described in gingival tissues of both gingivitis and periodontitis. So therefore, it's been speculated that gingivitis and periodontitis are typical sugar-driven inflammatory diseases that are similar to type 2 diabetes, obesity, cardiovascular diseases, and they're not just corollaries to systemic diseases. I can tell you that I know that diet is really, really important to controlling periodontal diseases, but I don't know that I ever quite looked at it that way in terms of fermentable carbs. I always think about fermentable carbs and caries, and we know fermentable carbs, we associate that with sugars, but I don't know that I necessarily associated that with one of the main causes of periodontal diseases. Again, and I'm going to keep stressing this, there's no one single parameter for the development of either diseases. No one single parameter responsible for the development of either diseases. Specifically, when we talk about dental caries, of course, our salivary composition is important. The bacteria in the plaque biofilm, which we just discussed, genetics, of course, we discussed pH, but it's those fermentable carbs in the diet. So let's talk about sugars for a minute. There are many different types of sugars, okay? So you have your natural sugars. Those are located in the cellular structure of grains, fruits, vegetables, milk, and milk products. And then you have those free sugars. So that's any sugar added to a food or drink, or the sugar that is already in honey, syrup, and fruit. And it's called free sugar because it's not inside the cells of the food that we eat. And then you have added sugars. And so those are removed from their natural source and added to food. So those are almost all of your mono and disaccharides, your honey, your syrups, your agave, and your nectar. Carbohydrates are classified as either chemical or nutritional. So the chemical classification would be a monosaccharide, a disaccharide, your oligosaccharides, or your polysaccharides. And then from a nutritional standpoint, they're either classified as a simple carbohydrate or a complex carbohydrate. Looking further at the chemical classification, so our monosaccharides, okay, so those are our fructose, our glucose, and our galactose. And then we have our disaccharides. And so you have probably the most famous would be your sucrose. And so that's a combination of a glucose and a fructose molecule. And then you have your maltose, which we associate with beer, sugar, and lactose, which is milk. And then, of course, you have your polysaccharides. And so they don't get metabolized by the body as well. So typically when you consume a lot of beans, a lot of starch, a lot of fiber, people can get really gassy. And it's these things that typically will increase that GI motility. So I always like to say it runs right through you. Dr. Robert Lustig, he is a pediatric endocrinologist, and he has been sounding the alarm on the dangers of sucrose and fructose. He has a YouTube video, and I encourage you to watch it. It's pretty old, came out in 2009, but he talks about sugar and the bitter truth. I would say probably one of the most surprising things that he has said is that he has called sugar the alcohol of the child. So I want you to think about that for a minute. Sugar being considered the alcohol of the child. And he's referring mainly to the fructose side of sucrose. Remember, fructose is that glucose and that fructose molecule. Fructose, of course, is a natural sugar, but some of these natural sugars have problems as well. So here I have fructose highlighted because these are some of the things that Dr. Lustig talked about fructose with. He said that fructose can lead to fatty liver in toddlers, and it's damaging because it's the primary sweetening agent in fruit. A lot of people think that fruit is wholesome. High density fructose from the juices of fruits is in nearly every available food to humans, even in infant formula. They actually put it on the coating of French fries. And when I think French fries, I don't think sugar. I really think salt. He goes on to say that our daily exposure to fructose is nearly immeasurable. Okay, we have no idea. And so what happens is that the liver is being overdosed. High levels are stored as fat, and then they're converted to this uric acid. And so this excessive uric acid in the blood is an independent risk factor for all types of systemic diseases, such as hypertension, metabolic syndrome, cardiovascular diseases, chronic kidney disease, type 2 diabetes, and Alzheimer's disease or type 3 diabetes. So type 3 diabetes is referred to as Alzheimer's disease. So in a nutshell, he's saying that fructose is not dentally or systemically a safe alternative to sucrose. It's unfortunate because there are people who get paid to get you addicted. There are people who actually go to school for a degree and they sit in the lab, and maybe during COVID, they sat at home. And what they do is that they find this bliss point, which is that perfect combination of salt, fat, and sweet. And so what they've learned to do is to exploit these properties. So it makes people want more. Okay, they create these foods and you want more. So think about every time you walk past a restaurant, okay, and you may smell, or maybe just outside of the fair, I can almost smell that funnel cake. I can always smell the popcorn. I can almost smell cheesecake. Well, I really can't smell cheesecake, but I like it, right? We are conditioned to be addicted to these foods. And when you are trying to make healthier choices, it can be really, really hard. Just imagine someone being addicted to some sort of drug. You probably have seen these shows all the time where they're doing interventions. And I don't think that people realize that sugar has that type of addiction. If you've ever watched a 600-Pound Life, and some of you are probably thinking, well, how is it people let themselves get that big? It's hard because they've become addicted to the food. So the World Health Organization, they have guidelines. So they have sugar intake guidelines for both adults and children. Number one, they say the intake of free sugar should be reduced throughout a person's lifetime, okay? And this is a strong recommendation from the World Health Organization. The intake of free sugar should be reduced throughout a person's lifetime. Another strong recommendation from the World Health Organization is that the intake of free sugar should not exceed 10% of total caloric consumption daily. Okay, this will help to lower dental caries. And why do I say strong recommendation? It's a strong recommendation because there is enough evidence to support policy. Okay, so 10% of total caloric consumption. So what does that equate to? That's roughly 25 grams of sugar for an adult. So if you're like me, you're like, okay, well, what does that look like? Well, to help you put it in perspective, if you were to drink just one soda or another sweetened drink, that would be roughly 49 grams of sugar. Think about it if you supersize it. So just with one drink, you have exceeded the number of sugar or the amount of sugar that you're supposed to have for that day. The problem is because of labeling deceptions, Americans, just everyone around the world, the globe, they're consuming more sucrose than they realize. Did you know that there are roughly 60 names for hidden sugar? The last recommendation, this is not a strong recommendation, but they do recommend less than 5% consumption. And this is a benefit to minimize caries risk throughout someone's lifetime. Unfortunately, Americans consume nearly 57 pounds of sugar per year. 57 pounds per year. And I know that this is not scientific, but I did see a meme somewhere on social media and it got me to thinking. And it said an 8-year-old has consumed more sugar than a person who lived about 100 years ago in their entire lifetime. That is how much sugar is in our food. Sugar is hiding everywhere, even in places you wouldn't expect it to be. Again, like on your French fries. So we definitely need to be concerned with prevention strategies to kind of pull this all together. The American diet is not very friendly. It is high in fermentable carbs. It is high in fat. These diets are forcing us, they're breaking down our resilience factors, and it's causing these shifts, okay? These pH shifts. And what's happening is that because there's this constant assault in our mouths at all time, the oral microbiome is no longer at a neutral state. The organisms living within our mouths are no longer in a symbiotic relationship. And as I've stated in previous slides, it's hard to bring that equilibrium back. So what we need to do is we certainly need to focus on prevention strategies to help our patients achieve optimal care. So the first thing we need to do is nutritional counseling. And as I stated earlier, there are several organizations outside of dentistry that support our role in this. What is one of the one thing that you definitely want to do is that you want to suggest modifications throughout your nutritional counseling that are conducive to a patient's lifestyle. And so what may be conducive for me is not conducive to you. But with this, you want to make sure that your patients are limiting the use of cariogenic foods during mealtime. You want to help them find acceptable substitutions for cariogenic foods. And then you want to encourage the limited use of sugar during meal preparation. And this can be really, really hard, especially if you don't quite understand what's going on yourself. So we talked about fermentable carbs. Fermentable carbohydrates are foods that are broken down to sugars in the mouth by salivary amylase, and they cause the pH to drop below 5.5. So that is the typical Western or American diet, okay? We know what happens with these fermentable carbs. Those are those sugars. And we know that sugar is not only responsible for caries disease, but again, it may be the forgotten cause of periodontal diseases. So there are several foods that can cause the pH to fall below 5.5. So our breads, crackers, and potatoes. So typically our starchy or sugary foods, you have your sweetened cereals, candies, cakes, refined wheat flour. I think candies and cakes are given, rice, pasta, pretzels, breads, several of your tropical fruits. I have sticky fruits listed here. So those would be like your fruit juice, okay? Even vitamins. We have to be really careful of vitamins, especially for kids. Those are really sweetened and they stick to the teeth. So we want to make sure that we're educating our patients about that. Bananas, but bananas, believe it or not, they are great. They provide many benefits, but they can cause your pH to fall below 5.5. So what are some foods that are cariostatic or non-cariogenic? So of course, you have your non-nutritive sweeteners, and I'm sorry that this is cut off here, but they are not metabolized as easily in the body. You have your proteins and your fats. They don't lower pH. They contribute to the buffering effects of saliva. And consuming these foods can help raise the pH in your mouth. You have your sugar alcohols. The more familiar one would be xylitol. So they have an inhibitory effect on pathogens that are responsible for caries disease. And of course, anything with phosphorus and calcium, again, that buffering effect that helps to increase the pH. They also increase in salivary flow, or you have an increase in salivary flow when you chew hard cheeses. Now, there was, well, I'll go ahead and read this first before I say that. So some snacks, we all like to snack. I know I am definitely a snacker. When you are providing nutritional counseling to your patients and, they say I'm a snacker, there are some snacks that do produce little or no plaque acid. Those would be your cheeses and your yogurts. What I love about doing these presentations that sometimes people will go back and watch this, and I'll get questions all the time. And the one question I got is, okay, you have yogurt listed here. Certainly you mean fat-free yogurt. So yogurt can be loaded with sugar. So typically I'm referring to plain yogurt, which to some people can be really disgusting. But guys, you can put like nuts in there, which we see as a snack that produces little or no plaque acid. But sometimes we have to do things that are going to be healthy for us. And so it won't always taste good. Chewing gum with xylitol. I always like to say that chocolate is good for me. Okay, so you have various products with cocoa in them. Again, your protein sources, meat, fish, poultry, and eggs. Licorice, bless all of you who love licorice. It is not my favorite for sure. Cranberries, tea. I have coffee listed here. So coffee is a little tricky. So some coffees have a lot of phenols in them, which we know can certainly be more cariostatic. And I don't know anybody that's going around asking how much or how many phenols are listed in their coffee. So this was another question that I got. If you tend to take your coffee with lots of cream and lots of sugar, then you're probably going to get a lot of plaque acid. Of course, wine. So I'm not specifically promoting wine, but if someone who drinks wine, there are some benefits to it. And then probiotics, and that's something that we will discuss a little later. So there are a number of sugar substitutes out there. So Shirley Gutowski, she has done a lot of work with regards to sugar and sugar substitutes and caries. And she wrote an article called The Taste of Sugar, New Ways to Deal with Sugar and Sugar Substitutes. And she put this chart together, and she listed the various sweeteners. Now, we need to be careful because not all of these sugar substitutes are always as friendly to the oral cavity. She did note that stevia does not promote oral biofilm. So that certainly is not only systemically friendly, but it's oral friendly as well. Of course, xylitol, we know that remains one of the best defenses. What studies have shown against early childhood caries or caries in general. It is certainly beneficial in terms of periodontal diseases and upper airway infections. So this is both dentally and systemically friendly. And then your erythritol. That has been shown to have a dramatic effect on in vitro biofilm. So it has also been shown to reduce caries in vivo. And so that is a good replacement for sucrose. So these are just different things for you to consider. What are some other preventative strategies? We have to improve oral hygiene. Your OHE appointment, oral health education time, the time spent during that appointment is the most important part of the dental or dental hygiene visit. And what studies have shown is that we spend the least amount of time here. Why? Am I listing improving oral hygiene? Because that helps to control the biofilm. There was an interesting article written about biofilm management, and Susan Wingrove offered some key highlights on how to control biofilm. She recommended the use of a power toothbrush, a water flosser, and mouth rinse. Important to note that alcohol kills single bacteria, not the biofilm. So the key is to get the bacteria before it forms into that biofilm. There are a number of mouth rinses out there that have therapeutic effects. You know, we have mouth rinses that have therapeutic benefits and cosmetic benefits. Mouth rinses that typically target caries will have some sort of fluoride in them to help promote the remineralization of the teeth. It can help prevent tooth decay. You have rinses that are antimicrobial to help reduce gingivitis and plaque. Even if you're using a mouth rinse, you still have to encourage your patients. I don't want to say dental flossing because not everybody flosses, to perform interdental care and brush. Patients are certainly looking for more natural options. There are some products that have garnered attention lately. Another good thing about some products that I have listed here, this would be your closest and your TheraBreath, is that they don't have alcohol. They're alcohol free. So sometimes you have to have that, especially for patients who may have an alcohol sensitivity. So both products definitely work wonders with helping with biofilm and treating any condition that it's designated to treat. I am a huge fan of water flossing. Water flossing is the technology. A lot of times people will say Waterpik. Well, Waterpik is a brand, so water flossing technology. There are lots of great products on the market. I am prone to use specific ones. I myself, I love a Waterpik. That was my first water flossing experience. Not to say that others don't work, but I absolutely love the Waterpik brand. What you see here is the Sonic Fusion. So oftentimes you'll have patients who say, well, I don't have time to brush and perform interdental care. And so this model here allows you to brush and water floss all at the same time. So water flossing, there are several scientific studies that suggest that water flossing improves gingival health by facilitating the removal of biofilm. I know that Waterpik has about 80 scientific articles that support this claim, and believe it or not, I have read each and every one of them. So water flossing, highly, highly reliable in controlling biofilm. Powered toothbrushes. So I remember there was a point in time when they stated that there was no statistically significant difference between using a power brush and a manual brush. There are recent articles that speak opposite of this, where we're finding that powered toothbrushes can be more effective in both the short and long term in helping to control biofilm or yielding more positive clinical parameters. So I'm not saying that you can't be effective with a manual brush, but if we think about it, during a given brushing session, right? We know that people should be brushing on an average of 2 minutes. Most people brush anywhere between 45 to 70 seconds. And if you've ever watched your children brush their teeth, that is another story for another day. The average human hand can only achieve about 200 to 400 brush strokes per minute using a manual brush properly. However, with some of these oscillating brushes, you can get up to, and this is an oscillating powered brush, you can get up to 8,000 strokes per minute. And with some of the sonic technology, you can get up to 30,000 strokes per minute. So it stands to reason why someone would be a little bit more effective with a powered brush. There are many different powered brushes designed out there. And each of these brushes, they're designed to bring a different concept to the table. So, recommend, I always say you use what feels good in your hand and what has the science to back it up. This was an interesting long-term impact study of powered toothbrushes, and it was an 11-year cohort study. So once again, we're finding that these powered brushes do work. They are definitely promoting clinical health. Arginine. So arginine has been studied for quite some time. Arginine is a unique amino acid. It has the potential to control the biofilm in the mouth across both hard and soft tissues. Arginine has been shown to play a direct role in oral health by altering plaque metabolism. So typically, arginine can't make a caries claim directly, but because of the mechanism of action, it increases pH. And anytime you have an increase in pH, there's a promotion of remineralization. Arginine is considered a non-essential amino acid, meaning it can be synthesized or made by the body. It is also called conditionally essential because it only becomes essential in times of illness and stress. And again, our mouths are continually under stress. Arginine is a natural component of healthy saliva. Based on what we've already discussed and what we know, that the oral cavity is constantly under assault, this arginine is going to become conditionally essential. So what happens when, just to kind of sum it up and keep it simple, when arginine is metabolized by the ADS pathway, one of the byproducts is ammonia, and this serves to increase the pH in the mouth. That is a very simplistic way of talking about arginine. In 1998, there was some research surrounding the benefits of prebiotic microbiome technology. And so they were researching how mixed oral bacterial communities can naturally interact with saliva to help maintain enamel health. And this is where you get a lot of your arginine bicarbonate, calcium carbonate technology. It was around this time this was developed. We know what arginine can do. We know that bicarbonate, it helps to neutralize acid. It is also naturally present in saliva, and calcium is naturally in saliva, and it is really, really important for remineralization. So when you put all of these together, right, the arginine and bicarbonate, they can help maintain the right acid alkaline pH on the tooth. And so this was revolutionary technology at the time. So there is a product called, there is a product out there that exists. I really love it. I'm a little addicted to it. It looks like a candy. This is not what it looks like, but this is the closest picture that I could find, but they're called Basic Bites, and it incorporates this technology, and it's really beneficial. It's almost like it's tricking the bacteria. So it's promoting a more alkaline environment. What studies are showing, and there's lots of studies on this. This is just some of the information here, that by taking 2 of these Basic Bites per day, you can actually shift that oral microbiome back to where we need it to be. So remember, we talked about where our mouths are under attack for so long that we no longer have that balance despite our best efforts. And so with this technology over a period of time, we can actually shift that regime back to a more healthy environment. Probiotics, that is another preventative strategy. Oral probiotics are live bacteria that are identical to the beneficial microorganisms that are found naturally in your mouth. What they do is that they may exclude or antagonize oral pathogens, and they can be useful to prevent oral dysbiosis and treat oral diseases. So oral probiotics are being used for a number of issues, for caries disease, periodontal diseases. It is important to note that research continues because it's really important that you have the right strains and the right combination and the right dosage to achieve the end game. So there are several companies out there that are now selling probiotics. I know ProBiotic is one, Burst is another company as well, performing salivary diagnostics. So saliva is becoming more accepted as a pool of biological markers. And so this is really helpful in terms of diagnosing and monitoring not only systemic diseases, but periodontal diseases and caries as well. So this can be a really good tool for dental professionals to incorporate to help better manage their patients' ranges of issues. So this could be a good link between the oral and systemic that we talk about. Then we shouldn't forget about our tried and true technology, fluoride varnish. We need to dismiss the fact that fluoride is just for children. Our mouths are constantly under attack. There are about 49 different varnish products on the market. So what makes one varnish product different from the other? It is typically the additives that they have. But I highly, highly promote the use of a fluoride varnish. Excuse me. They're good products on the market. I have two listed here. I have the Pro Fluoride by Voco, and then the Embrace line by PulpDent. Both are really good products. I've used both. I can tell you that one of the biggest differences between the two is that with PulpDent, you get that sustained time release. So every time that there's an attack in the oral cavity, you get the release of the available calcium and phosphate. It also has xylitol with it. Whereas with Pro Fluoride, you get an immediate release of fluoride. And there are different situations that call for different products, okay? So let's just say you have someone that's suffering from extreme hypersensitivity. You definitely want that immediate fluoride release. That's going to be really, really helpful to relieve that dental hypersensitivity. Whereas you have someone that has just a poor diet. And so you want that sustained time release that you get with PulpDent, the Embrace Varnish line. So that's going to be really important. Again, you have bioavailable fluoride, calcium, and phosphate with xylitol with your Embrace varnish. Dental sealants. We can't forget about dental sealants. They are underutilized in dentistry, and we definitely need to consider them. Most people are using a resin-based sealant, and that's fine. Again, different situations call for different things. The ADA has put out a statement, sealants are effective in preventing and arresting pit and fissure occlusal caries lesions of primary and permanent molars in children. But I think another thing is people assume that, we can only use pit and fissure sealants for children, and you also can use them for adults as well. There are great sealant materials on the market. Many are very effective. So you definitely want to consider contraindications, like any allergic reactions to the materials in the sealant. You will find that many of the fourth generation sealants have fluoride releasing agents. Some also incorporate calcium and phosphate, yet many still require a completely dry surface. I know we're close to time, so I'm going to kind of skim through this abstract here. Our mouth is a wet environment. And so most people are using products that are passive, that do not react with the oral environment. And this is really a negative approach to material tolerance and biocompatibility. So what we want our products to do is to react favorably to what's going on in the mouth. Our mouths are wet, water is present. And so whenever you have a material that can react with the natural environment in the mouth, that product is considered to have smart behavior. Also, products that behave smartly, if you will, can react to the different changes in the environment. We know that water is the source of life, and we actually need water in order for a lot of these biochemical processes to occur in our bodies. We talked about the main substance of our teeth being hydroxyapatite, that calcium and that phosphate. When you combine fluoride with calcium and phosphate, it makes the fluoride more bioavailable. Embrace Prevention, so that's another line with PulpDent. They have a sealant. So again, they have that fluoride, that calcium, and that phosphate. Good thing about this sealant material is that, it's constantly, every time their mouth is under attack, you get these products to release. So it actually makes the person more caries resistant, and it can help make the teeth stronger. So this product is working for you long after the patient leaves the chair. One of the things that I absolutely love about the Embrace sealant is that you do not have to have a completely dry tooth. And one of the things that is so frustrating for clinicians especially if you have a wiggly child or somebody who is really juicy, is that it can be really hard to keep the surface dry. And so this is where the wet bond really, really thrives. It is hydrophilic. It forms a positive association with water, and it is actually activated by the moisture that is always present in the mouth. So typically after you etch a tooth, you always want to have that dry, chalky appearance. And this is what happens after you completely dry the tooth. And what happens is that you get that slightly moist surface. And so with some sealant material, it absolutely will not work if the tooth surface is slightly moist. Whereas with this Embrace line, it actually will work. You absolutely have to have, and notice I said slightly moist tooth surface. I didn't say saturated tooth surface. So this actually works wonders, especially if you're working by yourself. Having a slightly moist tooth surface is what makes this product golden. What are the benefits of a moisture-friendly sealant? You don't have to worry about the sealant negatively interacting with the oral environment. And once again, you can work easier. Silver diamine fluoride. This is another preventative strategy. We know that silver diamine fluoride actually has twice the amount of fluoride ions in it. It can help treat multiple conditions. So many different benefits to it. You do have two different companies that manufacture silver diamine fluoride. You have Elevate and you have SDI. SDI has Revastar Aqua. It's a two-step process. What is the difference? The second step is the potassium iodide, so it minimizes this discoloration. So that's beautiful as well. And recent studies has shown that this Revastar silver diamine fluoride can actually help the accumulation of biofilm. So the significance about the relationship between oral health and overall health continues to be stressed in medical literature. Dental hygienists have a responsibility to educate their patients about the connection between nutrition, diet, and oral health. It is essential for dental hygienists to have a comprehensive understanding of the processes involved with conducting a thorough nutritional assessment. With having a thorough assessment of what's going on, you understand sugar and how it works in the body. So this understanding will help dental hygienists effectively gather information about their patients' dietary habits and use these findings to recognize key factors in the oral systemic relationship. I want to thank you so very much for joining me this evening. And if you guys have any questions, I will stick around and answer them. So let me see here. Let me go to the Q&A. First question is, are there attempts to use probiotics to restore biodiversity instead of using antibacterials that disrupt the microbiome and promote an environment where harmful bacteria thrive? So yes, I believe I did answer that question. Probiotics are definitely being used. And the benefits of using probiotics, again, is that we know you have to take them over a period of time. And again, it can be really, really difficult to restore that biodiversity, that synergistic relationship. And this is where a lot of work is coming in with those probiotics. So next question. Wouldn't the sonic fusion rinse the toothpaste away? I've always been stumped by this. So technically, yes, it could. It definitely could, but there are definitely some workarounds for that. So if you want to email me, I would be glad to answer that question for you. Thoughts on nanohydroxyapatite as an alternative to fluoride? I believe in it. Again, fluoride isn't bad, but not everybody likes fluoride. And nanohydroxyapatite has been shown to really fill in those microfacial lesions that we can't see. And nanohydroxyapatite, it really is comprised of what our natural tooth structure is comprised of. So it definitely makes the tooth structure stronger. At what age would you recommend to start a fluoride varnish? So I think that there are various opinions on that. You have some that believe as soon as the tooth is present, you would use a pediatric dose. Others believe you should hold off. I really don't like to say just because it's public. But I think, you need to consider the individual. So you need to, consider the age of the child. What are some of those external factors that may be predisposing that individual to maybe various diseases? Next question, are sealants worth using when they eventually fail and need a composite restoration? Well, I will say not all sealants fail, and there are so many different things that can contribute to the failure of a sealant. I will tell you that with the newer technologies and materials, that sealants are lasting far longer. There are some designed with material to make them really strong and wear resistant. So again, sealants are highly underused. And I do not believe that anytime a sealant fails, you need to replace with a composite restoration. So I think if you start to research minimally invasive dentistry, in addition to sealants, people would use like a glass ionomer. They're using silver diamine fluoride. They're constantly treating with fluoride varnishes. So yeah, I would still say yes, use the sealant. Do I recommend alkaline water? Oh, that's hard because we assume something is water and it really isn't water anymore. Yes, if it's available and it's actual water, then yes. You are welcome, Talia. 2 questions. Is unsweetened seltzer a tooth-safe beverage? And is unsweetened seltzer that it's flavored? I don't know the answer to that. So this was a question about, is an unsweetened seltzer a tooth-safe beverage? I'm still thinking about the acid potential. So again, I don't want to say yes or no, but in my mind, I'm thinking about the acid potential. Would fluoride, the silver diamine fluoride help if there's a small carious lesion? Absolutely. And so again, that goes back to the principles of minimally invasive dentistry. What you don't want to do is sit and watch it. But silver diamine fluoride has shown to be really, really promising in helping to heal the tooth from the inside out. Do you ever recommend patients test their oral pH at home? I saw someone last week with a lot of erosion and thought it would be helpful. Yes. So I think it's a great conversation starter with your patients. I don't think they realize that the pH is what's doing a lot of the damage and the sugar is shifting the pH. So I would not be opposed to having patients test their pH or certainly having it tested in office. Is it safe to give a pregnant patient a fluoride treatment? So that is the $1 million question. I do know that silver diamine fluoride is contraindicated for pregnant women. Some fluorides are safe, but then you have some people that are afraid that it's going to make its way to the fetus. But then we also know that when a woman is pregnant, that's when she needs the most help. So I had fluoride treatments when I was pregnant, and you're going to find different opinions in the literature. Seltzer has a pH of 3 to 4, just like soda. So thank you for that. Again, my mind went to the acid content. Let's see. I think that is it. Well, thank you so much. I have enjoyed all the questions. If you have any additional questions, feel free to email me. I promise you, I respond. I hope all of you have an amazing rest of your day. And I look forward to the next time I can present to you. Thank you so much.